Joining us in our studio once again now are two of our young reporters who've been actively involved in the ECCMID Congress this year by reporting back on it rather than just attending as delegates. Let's find out what the both of them have discovered and what they've most been intrigued by and involved in. And turning to you first and foremost, Zaira, welcome back, if I may. How was the Congress for you? What have you found as a young reporter this year?
It's a very nice Congress. For me, it has been a very nice experience. I have met a lot of friends and a lot of young and senior investigators. Mm-hmm. We are sharing different experience, sharing different researches, and it's very useful for us as fellow to have the opportunity know about this topic.
So what have you been mostly looking at? What have you been attending?
For me, the most important topic in this Congress is the threatening of multi-drug resistant pathogens. And the topic of antimicrobial resistance is a very important problem in worldwide problem. And it's very useful for me because it's my main field in which I work.
And there were lots of areas to go and look at
Yes.
in terms of antimicrobial resistance this year as well. How did you choose, Zaira, which sessions to attend?
For example, today is a very nice talks about, it's called clinical ground. It's typical in ECCMID. It's very interesting because different fellows present their cases or rare or strange cases in their hospital.
Of some of the most up-to-date cases
Yes.
as well.
Uh-huh.
Yeah.
And different experts discuss about the case, and it's a nice talks.
Awesome. Let's turn to Georgia, if I may, as well, one of our other young reporters. When we first met, you were a little bit swamped by it all. You were saying, wow, there's so much to choose from. I'm not sure how I'm going to decide. How did you decide? And welcome back, by the way, Georgia. Nice to have you.
Oh, thank you. It's difficult. It's difficult to tell. There's so much things
It's a busy
in this
program.
conference.
Mm-hmm.
Yeah, it's really busy, and I think it's not possible to report on all the conference. We should stay here talking for hours.
Yeah. Yeah.
But I mainly followed sessions concerning my own fields. So tuberculosis, emerging infections, but I also want to hear something new for me, like antifungals or antibiotics. But I mainly focused on TB and emerging
There were some new
infections.
numbers on TB that came out this year as well, talking about the fact that although this disease is largely treatable and curable, it's also changing and mutating quite a lot, and the number of cases of TB this year have been quite remarkable, haven't they?
Yeah, tuberculosis is actually now the leading cause of death, of infectious leading cause of death worldwide. There were over 9 million cases, incident cases in 2015, and about 1.5 million deaths worldwide.
Resulted in deaths, sadly.
Yeah. So this is actually the first cause of death alongside with HIV. And I think that we are not well aware of the importance of this disease at global level. Tuberculosis is often forgotten. I mean,
Yes.
Thought of as an old, manageable disease from the
probably.
19th century even.
Mm-hmm.
Yeah. It has almost disappeared from high-income countries like Western Europe, but it is still a problem, and it is still a major public health concern, especially in developing countries. But what we also should remember that there is a large proportion of people that are actually infected with TB bacteria, even though they are not ill. It is important to distinguish between latent infection and active tuberculosis. So latent infection is thought to affect around 1/3 of the world population, which is an extremely high number, and it is probably impossible to test everybody and to treat everybody. But we have to know that some people may be at high risk of developing active TB, so undergoing a reactivation of latent infection, which is usually a consequence of some risk factors like HIV, which is the strongest risk factor for TB reactivation, but also other factors such as immunosuppressive treatments, biological drugs, such as those used for rheumatic diseases or inflammatory bowel diseases, and transplant recipients, patients treated with steroid drugs, or what else? Well, of course, children are at high risk of reactivation, and children are a great concern in public health because there are currently few drugs that are suitable for use in pediatric age. So we need new formulations, and we need new
antibiotics
approaches to improve the access to treatment and to improve the outcome.
Now, the sheer volume of discussion at ECCMID this year on something like TB, was it enough for you as an emerging expert yourself in the area?
Yeah, actually, I heard many interesting presentations, especially focusing on new diagnostics and
rapid diagnostic.
Yeah. What I found more interesting is the research that is ongoing on LGBI diagnostics. I mean, latent infection diagnostics.
And there's a good opportunity for you to collaborate and meet the people who are working on that, things like that.
Yes.
Yeah. I also met some people. It was really interesting. It is always a good opportunity.
And as you say, we could talk for hours on it. So
Yeah.
let me turn to you, Zara, because you're nodding away
that's
there.
true.
You're agreeing with everything that you're hearing. What's your biggest takeaway this year from ECCMID, do you think?
I think the main message is that we are a very strong specialist, and we are to fight together against the main problem actually, that is antimicrobial resistance, also in tuberculosis.
Of course.
And we need new antibiotics because there are lack of antibiotics, an important lack of antibiotics.
New drugs for bad bugs. That's what we need.
Yes.
Absolutely. And your biggest takeaway, going back to you then, Georgia, from your side? You've obviously enjoyed yourself enormously here at Congress.
Yeah.
When you go home and your family say to you, what was the highlight? What are you going to tell them?
God. As I was just saying, new diagnostics were the most important, the most interesting thing I heard. Not only for TB and latent infection, I mean also for example, Zika virus and also malaria.
Of course.
So I think there is really a lot to discover and to, yeah, we'll see.
Looking back on it, a great experience for you both.
Yes.
Yeah.
Awesome.
Expect repeat next year.
I look forward to that. Seeing you in Vienna, it's going to be even bigger and better,
Yes.
if that's possible, which of course it will be. Thank you both very much indeed for
Thank
being
you.
involved in our
Thank
Young
you.
Reporters program
Thank
this
you.
year. Thank you. A pleasure to have you.